Today, I am going to be talking about preventable causes of maternal morbidity and mortality, specifically between Poland and the United States. So, we are going to be looking at some demographics. We are also going to be looking at some ethical considerations and policies, as well as some other things that do play a role in the type of healthcare that women get and how it contributes to the maternal mortality and morbidity rates within each country. So first, we are going to be looking at the demographics of maternal morbidity and maternal mortality rates in general, affecting all women worldwide, not specifically geared towards Poland or the United States. So first, we are going to be looking at the maternal morbidity. So, according to the WHO, any health condition attributed to and or complicating pregnancy and childbirth that has a negative impact on the woman's well-being and or functioning is considered maternal morbidity. Severe maternal morbidity, as per the CDC, is any unexpected outcome of labor and delivery that can result in significant short or long-term health consequences. Severe maternal morbidity affects approximately 60,000 women in the US each year. Some common morbidities do include cardiovascular disease, infection, bleeding, high blood pressure, and blood clots. Maternal mortality, according to the WHO, is the annual number of female deaths from any cause related to or aggravated by pregnancy or its management, excluding accidental or incidental causes, during pregnancy and childbirth or within 42 days of termination of pregnancy, irrespective of the duration and site of the pregnancy. Some common causes of maternal mortality are hemorrhaging, which is severe bleeding. This is most common after childbirth. Infections, which are also most common post-childbirth. High blood pressure during childbirth, which is known as preeclampsia. There's also eclampsia, which is seizures that are caused by preeclampsia. Unsafe abortion. And then there's also complications from delivery itself. According to the NIH, each year more than 500,000 women between the ages of 15 and 49 die of causes related to pregnancy and childbirth. This is a leading cause of death among women in that age group. General prevention and accessibility with worldwide with all women. Some preventative measures that women can take to prevent maternal morbidity and mortality. The best way to prevent maternal morbidity and maternal mortality is to attend regular primary care, prenatal care, postpartum, specialty care appointments. So this helps by making sure that your pregnancy is on the right track. You could prevent any issues in your pregnancy or find them before it causes a big issue. Um, you'll also be able to identify any type of morbidities that are presenting within any term or time span in your pregnancy. So accessibility to care, there is kind of a downfall of that. So one of the issues is poor quality of care for women. Some women are not getting the type of care that they need. They're being not being able to be seen. They're getting rushed out. They're getting told that that's not what, like, if they present something to someone and say, I think this is this, they're getting downplayed. Um, Social detriments, that's another issue for accessibility to care, um, as well as harmful gender norms. So with the harmful gender norms, there is inequalities that can result due to women's rights and having a low prioritization of that. Um, And then for the social detriments, there is issues like low income, um, as well as access to education. It's dependent on your race and your ethnicity, as well as some subpopulations are at a greater risk. And then I also have one of these quotes here from one of the articles I found. To improve maternal health, barriers that limit access to quality maternal health services must be identified and addressed at both health system and societal levels, which is very true. Understanding that both societal and the health system need a reform. Women shouldn't feel like they can't have access to health care that they need, and the healthcare system should not be making them feel that way. Next, we're going to look at demographics of countries specific to Poland and the United States. So, for mortality rates in Poland versus the United States, Poland, they do have 2 deaths in every 100,000 births. These statistics were taken from 2020. The United States does have 32.9 deaths per every 100,000 births. The US has one of the highest maternal mortality rates in the developed world. In addition, there are extreme racial and ethnic disparities in rates of pregnancy-related deaths. This is also due to the inequality of healthcare seen between different races and ethnicities. It is harder in some areas to get healthcare. Those are areas that are predominantly populated by those who are of lower income. Um, and that does contribute to the mortality rate within the United States. Some things that are similar and different in Poland, referring to prevention and contribution to the morbidity and mortality rate. So for in Poland, there is free maternal care in the public sector for all women. That does not, it's not the same case with the private sector. Um, there are challenges of being on wait lists to get in to see doctors just to have some type of care and make sure that their pregnancy is running smoothly. There is an option for private care, but unfortunately, this is more unaffordable for most women in Poland. Um, but another issue is that there is a shortage of maternal care providers, especially midwives, which also links to the wait lists and the issue of having to wait a long time to get in to see doctors or midwives or an OBGYN in Poland. Another issue in Poland is that there is bad communication between the provider and between the patient, which would be the woman intending to give birth or is in the middle of pregnant with a child. So those are some of the issues in Poland. Some of the issues in the United States, there is insurance which covers a lot of maternal care, but it is not a guarantee that everything will be covered. If you do need to see any specialists or anything like that, it might not be covered by your insurance, which you will have to pay out of pocket for. An issue with that is if a woman is seeing an OBGYN or seeing a doctor normally to make sure that everything is going smooth with their pregnancy, and then, for instance, something's not and they do need a specialist, they might be required to pay out of pocket for the specialist, which for some women it's very unaffordable. Um, this puts them in a bad situation with their pregnancy because they aren't able to make that appointment with the specialist. And if they are, then they're really, it's a detriment to their own self because now they're low on money and not able to, or they're not even able to afford it. And then if they have the money to afford it and they're low income, then they can't sustain themselves to have a good pregnancy, like get the stuff that they need to have a good pregnancy and make sure that they stay healthy and be able to provide and get stuff for their baby before the baby even comes. Something that the United States is doing is something called safety bundles that they're implementing. And safety bundles is a set of practices and policies that is designed to identify appropriate and timely actions the healthcare staff can take in response to maternal complications. So this is really good because it makes sure that the healthcare staff knows what they're doing and knows what actions to take in the event of something happening to the mother. Some cultural similarities and differences between women in Poland versus the United States. So, when it comes to Poland, exercise and diet contributes to healthier pregnancies. In a study that I found from Poland, it does state that women mostly consumed fruit, salty snacks, dairy, sweet drinks, and desserts between meals. They didn't eat as many nuts or vegetables. So same for the United States. Diet and exercise contributed to lower complications during pregnancy. In a report that I found from the United States, it does say women who report prudent or health conscious eating patterns before and or during pregnancy may have fewer complications and adverse child health outcomes. We are also going to look at the average age of women giving birth in Poland versus the United States. So the average age for a woman giving birth in Poland was between, this is from 2022, it was between 30 and 34 years of age, while the average age of a woman that gives birth in the United States was 27.3 years of age. This could also cause some differences due to the average age for a geriatric pregnancy, which is considered to have more complications, um, which would be more maternal morbidity, leading to more maternal mortality. That is the age around 30, you'd see that, which is considered geriatric pregnancy. Um, which unfortunately for Poland, that is their average age of woman giving birth, so we can see some differences there. The woman in the United States do tend to give birth a little bit earlier, which is helpful in terms of maternal morbidity as well as maternal mortality. So, some political policies and care. The United States does have policies in place to help poverty-stricken families face the challenges of pregnancy and maternal care in an affordable way. This also helps to promote and maintain a healthy pregnancy. So, in the United States, they do promote ways to maintain a healthy pregnancy, such as places you could go for care, what type of care you need. If you're having any issues, like you could go here, you go there. The only issue with that is the affordability and the access to these care providers that are being advertised. In Poland, they do have public maternal care services available for free for all women, which also that's a benefit for Poland. The downside of it is the wait lists and how often that you do have access to that kind of care. Um, but like the United States, Poland also suggests positive ways to maintain a healthy pregnancy, such as um, maintaining a healthy diet, exercise, where they could go if they have any issues. For those that do choose to have private care during their pregnancy, there's also the public care that is available. Some ethical considerations and actions. In Poland, public hospitals are more equipped to handle crisis. So mainly public hospitals do handle the most problematic pregnancies or childbirths. Um, while some women opt to pay for private care for maternity care, the private hospitals aren't always as good of a fit to serve a woman that is having birth complications or pregnancy complications because they don't have the means to handle emergency events or situations. Access to private care is less affordable, so more women do tend to opt for public maternal care, and it does make it harder to see a caregiver or a specialist in Poland due to the longer wait lists that stem from the free maternal care that is given. In the United States, insurance covers the cost of a lot of maternal care, but additional needs, such as specialists, might have to be paid for out of pocket. So this is somewhat unaffordable because a lot of the health maternal care in the United States is covered by insurance, but like I was saying earlier, there is that downside where if you do have to see a specialist, you will be paying out of pocket, which in some cases isn't always feasible for women that are poverty stricken or low income or certain classes that can't afford to see a specialist. And then it puts them in a bad situation because they need that help and they need that care. So we could do better in that aspect of making that a more achievable thing where women are able to get that care without having to feel like they're jeopardizing their income or jeopardizing their savings or don't have enough to provide for their child post-birth. Um, so this is something that we do have to consider. So for abortion rights in Poland, within Poland, a total ban exists for abortion. Doctors may not allow a patient to have an abortion. This has led to a few deaths in Poland due to doctors denying a mother to have an abortion. This jeopardized the mother's health and ultimately led to their death. So in Poland right now, they are also actively working towards overbanning the abortion ban. So this would be beneficial on a number of levels. Unfortunately, for those women that did lose their lives due to the doctors not letting them have an abortion, that wouldn't have been the case if there was not an abortion ban. In an article that I found from Poland, it stated that compared to other European countries, Poland is witnessing an unprecedented retrogression in access to safe and legal abortion. Its recent actions are in direct contravention with the recommendations of UN treaty bodies and other human rights bodies. This leads to the question of how the ECTHR would adjudicate when faced with applications filed against Poland by women who were denied abortion on embryo pathological grounds. So unfortunately, Poland is facing a serious issue with being able to have a legal abortion, and they are currently working on that right now to get that overturned so women are able to safely have abortions. As for the United States, Roe versus Wade has been overturned a few years back, and that did make it significantly harder to get access to have an abortion within the United States. This is bad on a number of levels, just because some women have to travel out of state to gain access to have an abortion. It can jeopardize their health. It is still legal in some states. An article that I found from, or an article that I found from the United States states that abortion bans or restrictions States with abortion bans or restrictions experience adverse outcomes, including limited maternity care providers, maternity care deserts, higher rates of maternal mortality and infant death, especially among people of color, elevated death rates for birthing individuals of reproductive age, and greater racial disparities in healthcare. So unfortunately, this is across all races and ethnicities. We are seeing it more prevalent in people of color. As for the age respect, we are seeing it higher death rates for birthing individuals of reproductive age. So, summary and conclusion, in both countries, improvement needs to be made. This is societal on a societal level as well as within the healthcare level. There should be more affordable access to care as well as better ways to get care. As for Poland, they do have free maternal care for all women, but with the downside of that is that there's longer wait lists to get in to see these care providers. Um, for the United States, healthcare does need to be more affordable overall in a general sense, especially for maternal care. Um, as for a communication respect, there also should be a better system there. That's also where there's a lapse in women getting the appropriate care that they need during their pregnancy. As women are tend to be looked down upon, they aren't as often heard or listened to when they are trying to voice concerns regarding their pregnancy or regarding their birth. Um, and then there also should be some more ways of promotion to maintain a healthy pregnancy. There are a good amount of promotions and advocates for promoting a healthy pregnancy as well as what you can do to continue to promote a healthy pregnancy. But overall, there could be a little bit more done there to improve maternal mortality and morbidity rates, and this is within both countries. And with these improvements, we will see a decline in maternal morbidity and mortality.